The last question is actually from two people, and it's a rather large question. It's a question that comes in rather frequently as well. When people have Asperger's, they're often misinterpreted. We all know that. But sometimes this misinterpretation could actually get violent to where police people or other people will put handcuffs on the person with Asperger's syndrome because either they were not answering questions or they were acting strangely. These situations are occurring way too frequently. And Aspie and Inkspot have both written in talking about these situations. And they're asking the question, how does someone with Asperger's and anxiety learn to cope in situations where someone may or may not be aware of autism and Asperger's? What can they do to help save the situation so they don't get incarcerated or they don't suffer the violence at the hands of innocent people to some degree?
The incarceration can also be in a psychiatric unit. It doesn't have to be in a jail. And so sometimes the police will recognise the person is unusual and they'll refer them to psychiatric services and they'll be imprisoned in a psychiatric unit. The problem is in that intense emotion, the coherence of speaking, the clarity of thought, the ability to explain yourself has gone. What I recommend is the person carries with them, as much as if you have diabetes, etc., not only a device that the emergency crew will look at that and realise diabetic, could be in a coma, we know what to do. But they have in their pocket a series of cards that describes themselves and Asperger's. Sometimes I get very angry and write it as urge to the person. You may feel that I'm being psychotic. You may think that I'm being irrational. You may be actually scared by my behaviour, but I have Asperger's syndrome. This means I'm misinterpreting your body language. I'm not very good at understanding the game of how to deal with officials. So you have that as a card, and if you're absolutely, and hand it to them, but that has a rational explanation of your situation. If in doubt, contact this number, a relative, a friend, who can give the other opinion. So to ask the person with Asperger's to suddenly create a persona or ability to translate what they're doing, in those intense moments, not possible. So you have it on a card with enough information. If in doubt, contact this person, but this explains why I'm like that. What I need is solitude. What would be the worst thing to do is to try and restrain me. I need time to calm down. I will then be able to explain. You need not to be angry with me, but to be supportive. I don't seek compassion, I seek concern and solitude. So it's going through, this is who I am, this is what I need. And if I don't get that, this will happen. If I do get that, this will happen.
Okay.
So they need it in a card. They can talk to somebody about what's needed, but they need to have that. So the person goes, oh, all right.
Yeah.
I'll back off then.
It
makes sense.
Has anybody produced a card like this? Are there template questions?
Oh no, it's unique to the individual, and I think should be personalised. In terms of, this describes me. You know, I have Asperger's syndrome, like saying I am diabetic, I appear drunk, but I'm not, etc. And police are trained to pick up somebody who's diabetic and is not in a stupor because of alcohol, you know, and just leave them and they die. This is actually identifying that my unusual behaviour is actually quite logical, but I have intense emotions, and this is how I react, and this is how I would like you to react to me, to rescue both me and the situation.
People with Asperger's syndrome, especially younger people with Asperger's syndrome, midlife people, 20s and 30s, don't have the wisdom of somebody that has lived a life on the spectrum and seen that it does actually get better. How do you tell people on the spectrum, Aspergians, to deal with the depression that leads to suicide? How do you tell them suicide is really a non-option?
What a waste of talent. If you went, we'd all miss your abilities. And you've got a talent. Asperger's gives you a talent, and it's God's waste if you've been granted that talent and you throw it away, because it's a different way of thinking. You've got talents. You may not have realised them yet, but they're there. We'll find them. We'll develop them, which will give you a sense of self-worth. But you don't have any self-worth. You have no respect. There's no sense of value. There's painful aspects of life, the way people approach you, the way you think you're not going to be successful in your ambitions, etc., that leads you to feel depression. In other words, your depression is a sensible reaction to your predicament. Anybody in their right mind would also feel pretty depressed in that situation. But we've also got to change the way you look about this particular problem. It's the way you perceive it, it is going through that you have particular qualities. Now, often the person with Asperger's in that situation would, no, 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 no. Well, you're saying no now, but have a think about it. There are particular qualities that you've got. And to go through how they can be used successfully and to achieve success. One of the major problems is that the person has absorbed the criticism of childhood from peers and teachers and believed it. And I have to say, change the logic. Why would they say that? Because they don't understand you. They enjoyed hurting you, but you've absorbed it. You didn't react, but that was a pain, a poison that stayed within you. We've got to get rid of that poison, toxic teenagers in particular. We've got to explain why you were targeted. Logic. Because they wanted to show off to other kids. It wasn't anything to do with you. You've internalized it and blame yourself. No, it's nothing to do with you. They didn't care who you are, but they found you an easy target.
Right.
So it's explaining other people. It's nothing you can cure within a couple of sessions. It takes a major paradigm shift of looking at the person more positively. But that's why it's crucial, because otherwise we'll lose someone. What I've found clinically is when I'm dealing with the teenagers when they're going through this, is the support from other teenagers with Asperger's who I've been through it, and you know, they give them advice and say, yeah, no, that's how you feel now, I felt that way. It's intense, but you know, it'll go, there'll be changes and so on. So it's a combined effort by psychologists, psychiatrists, etc., but also peers with Asperger's to support each other. And that's what I'm looking for, and what I eventually want to develop is a psychotherapy for Asperger's by Asperger's. And I'm delighted that some Asperger's now are going into psychology and psychotherapy. And all the psychotherapy models are based for neurotypicals, but they need to be based on Asperger's for Asperger's. And so I'm now finding I have colleagues with Asperger's syndrome, and I'm very confident to pass on my clients to that person because I know they have credibility.
Excellent.
Because they've been through it themselves. And Asperger's know a fake. They know somebody who's just trying to cheer them up, but they really don't know. They haven't been it through it. And for a person who has been through it, that's convincing.
Are you aware of any more mentorship programs where a young and an old, such as big brothers or big sisters, but in this case they both have Asperger's? Are you aware of any more of these programs around the world?
Not specific programs, but we're trying to look at making a connection between various people. And it may be something that can be done by the internet, etc., so that you can get what I call the wise tribe of elders. I would love to have a group of a dozen or so wise men and women of Asperger's syndrome that take on board these questions and give advice for Asperger's by Asperger's. And I think that would be very good.
I wonder if that's something for Wrong Planet. Alex Plank might be able to do something like that at Wrong Planet.
Yeah, I think that would be a really good, I think that would literally save lives.
So if somebody has Asperger's and they're in their 30s and they're starting to really feel the hopelessness and they're looking at suicide as a possible option, can you tell them if your gift is art, continue to do art? If your gift is this, continue to do that. What advice do you give people in that situation?
You've got to follow your heart. And that's what you should do. So if you're a lawyer because you want the money and the parents expect you to be a lawyer and it has status, but really you're an artist, quit law, be an artist. Be a poor, happy artist than a miserable lawyer. Okay? You can cry in your Mercedes, but it'd be better if you laugh with your paints.
Oh, wonderful advice. Dr. Tony, thank you. I can't wait to do this again.
Well, thanks, Craig. Delighted to be able to do that.
And thank you, Autism Hangout. Keep your questions coming. We're all learning through this. Good night.